Of course, when people message me on WhatsApp, sometimes I'll pause to reply them and all of that. So the first discussion we should be having, that's the first artery we'll be looking at. We'll be looking at the arteries and the veins all together. So the first artery is what is known as the anterior tibial artery. We'll look at the anterior tibial artery. Okay, that's the anatomy. It's just anatomy. Okay, so we look at where the artery is coming from, where it is supplying, the clinical significance and all of that. Then if you are looking at these videos I'm recording, which I'll upload later, you see beautiful pictures about it. So the anterior tibial artery, from this picture we could actually locate the anterior tibial artery here. Okay, and it's actually one of the two terminal branches of the popliteal artery, so it's actually coming from the popliteal artery. All right, so it passes through the interosseous membrane into the anterior compartment of the leg and runs down alongside the tibialis anterior muscle and continues on the dorsum of the foot, that's at the back of the foot. So at the back of the foot, that's, if you look at the image down, it is this artery that becomes the what? Dorsalis pedis. So what's the anatomy of the anterior tibial artery? Origin arises from the popliteal artery at the lower border of the popliteus muscle. So it's one of the two terminal branches, okay, of the popliteal artery. The other one is the posterior tibial artery. Okay, so let's still locate it. We said that this is the anterior tibial artery. Okay, very beautiful. So cause passes through the opening in the interosseous membrane near the upper tibia, descends into the anterior compartment of the leg, lying between the tibialis anterior and the extensor digitorum. Okay, so it runs with the deep fibular nerve, that's also known as the peroneal nerve. It crosses the ankle joint midway between the malleoli. Okay, and this same artery is the artery that continues as the dorsalis pedis. Okay, so branches, have some branches. It gives rise to the anterior tibial recurrent artery, gives rise to the muscular branches, gives rise to the medial and the lateral malleolar arteries. Then at the back of the foot is this same artery that gives rise to the dorsalis pedis artery. So what does it supply? Okay, what are the structures of the body that this artery supplies? It supplies the anterior compartment of the leg, supplies the ankle joint and the foot. So what are the clinical notes? You have to know about the anatomy of this artery because you need it. Okay, if you want to dictate pulse, the dorsalis pedis can be dictate the pulse there. Then it can also be affected by peripheral vascular disease. It has importance in surgery, like all those vascular grafts and trauma repairs of the leg. Then you should know that this artery works with the posterior tibial and the fibular arteries, just to maintain blood supply to the foot. That's like collateral supply in case there's any issues coming up.